So, welcome back, guys. I hope you are all doing well. So, today's my topic of discussion is primary olfactory cortex, okay, which is present deep in the temporal lobe. So, guys, first I draw the picture related to it and tell you the area of the primary olfactory cortex and association cortex. This is our brain, okay. So, here I draw in green color the primary auditory cortex, okay. Second one, auditory association cortex, okay. The third one is, which I discussed in previous lecture, is Wernicke's area, okay. Now today's my topic of discussion is primary olfactory cortex, okay, and association cortex, which I highlight here, which is present if we remove the temporal lobe from here, okay, and we go deep in the temporal lobe like I highlighted it, okay. Deep in the temporal lobe there is primary olfactory cortex, okay. First we remove the temporal lobe, and deep in the temporal lobe, okay, there is primary olfactory cortex, okay. So this is the location of the primary olfactory cortex, and with the primary olfactory cortex the olfactory association cortex also follow the primary olfactory cortex. The association cortex also follow the primary olfactory cortex. So these are the area which is present in the temporal lobe, deep in the temporal lobe, okay. So now we know the function of the olfactory pathway, and what are the pathways related to it, okay. So what is olfaction? Olfaction means you have a sense of smell, okay. You have how you smell, what are the pathways involved in it, I explain you detail in this video, okay. So I draw a little bit more structure. It is black in color. Basically I draw a pathway which is black in color. So guys, this is the pathway related to olfaction, okay. What is this? This is olfactory bulb which is present at the base of the frontal lobe, okay, which sense the smell. How it sense the smell? You know the olfactory nerve, the cranial nerve. The first cranial nerve is olfactory. So olfactory nerve sense the smell and send that smell to this olfactory bulb, and all the information from the smell, any type of smell, any type of olfaction, like bad smell, good smell, perfume smell, like all type of smell which goes towards this area, olfactory bulb, then it goes inside the olfactory bulb. There is olfactory tract, okay. Inside the olfactory bulb there is olfactory tract, and from here the information goes towards this primary olfactory cortex, okay. Information goes to primary olfactory cortex. So there is a olfactory bulb which is right here, olfactory tract which is here, and what are the third name of this pathway related structure? What are the third name of it? uh, um, Medial olfactory striae, okay. Medial olfactory striae are the third structure. So if I elaborate and tell you more detail related to it, so this is two areas in the brain, okay, and there is two pathways which are connect these two areas, okay. This is olfactory bulb which I draw anteriorly at the base of the frontal lobe, and their connection with the olfactory nerve at the cribriform plate of the erythmoid bone, okay. Cribriform plate of the erythmoid bone. So what are the pathway? I have to draw it again, okay. Any type of smell stimulus comes to this area, Okay, any type of smell stimulus comes to olfactory nerve, which is present at the cribriform plate of the arythmoid bone at the base of the skull in the anterior cranial fossa. Okay, now this information of the smell travels to olfactory bulb. Okay, this is the olfactory bulb. Now it enters in the olfactory tract. This is olfactory tract. Okay, this is olfactory bulb, which is present right over here in the superior diagram. So now the information comes to this tract here, and it enters in two sides. I have to draw it in green. It enters in this side and in this side. Okay, there are two structures, one is this and one is this. What are the name of it? Okay, one is medial olfactory striae and the second one is lateral olfactory striae. There are two striae. Okay, there is a pathway. Striae is a pathway. Medial olfactory striae and lateral olfactory striae. Now information comes to medial olfactory striae. Okay, sense of the smell. Okay, and here what happened in the medial olfactory striae, I have to draw again a little bit more elaboration. Okay, this is two areas. Here is two pathways, and here is olfactory bulb, and here is cribriform plate of rhythmoid bone where the information of the smell comes. Okay guys, you know all the pathway. So now the information comes to this area, okay, of the brain. What's the name of these areas, these two areas? Okay, you know the pathway names. Okay, medial olfactory striae and lateral olfactory striae. Now the what are the name of these areas, which are two big areas in this diagram where information goes? So the first area, which is right over here, this is orbitofrontal cortex. One is orbitofrontal cortex. Okay, what are the name of the second area? Second area is primary olfactory cortex. Okay, which I discuss in this lecture, primary olfactory cortex. Now the information from the cribriform plate of rhythmoid bone enters in the olfactory bulb, olfactory tract, olfactory striae, and enters over here. Also a little bit goes over here. This area is present in the frontal lobe. Okay, now the information comes over here, and what happens over here? The primary olfactory cortex takes the information and send to the other area. What are the name of other area, which is also present in the temporal lobe? This area is olfactory association area. What are the function of this area? Okay, olfactory association area. Olfactory association area function is it recognize, analyze the smell. What type of smell it is? Is it bad smell or is it good smell? Okay, so all the information comes over here, recognize, analyze, and compare with the past memory of the smell. You know that type of smell, you can smell this type of smell in the past history. So all the information comes over here in olfactory association cortex, which is present in the temporal lobe, just inferior to the parieto. This is, what is this area? Primary olfactory cortex and olfactory association cortex. Okay, now olfactory association cortex knows all the information related to smell. Okay, so all the information goes towards the olfactory association cortex, and also this information of the smell goes towards another structure which is present in the brain, which is amygdala. 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 Okay, amygdala, which is present in the brain, amygdala. Okay, and it controls how you react with the smell. Okay, is the smell bad and you have to you disturb from the smell and you are shouting and speak loudly, this is very bad smell, like you your facial expressions. Okay, you give the expression and you give the reaction to that smell. If it's good, so you are happy. Is it bad, you are very you are shouting to that smell. Okay, and speaking very badly to that smell. Okay, so what are the reaction control during the smell is amygdala, and how the information goes towards olfactory association cortex, and olfactory association cortex analyze, recognize and determine the what type of smell it is. Okay, so this is all the pathway related to olfactory association cortex. Okay, and primary olfactory cortex, how the information enters and how the information goes, and what part of the brain receive the information of the smell, and uh, uh, how we respond to the smell. Okay, so here is one clinical importance when there is damage to this pathway. Okay, there is damage to the due to trauma, there is a damage to the cribriform plate of the arythmoid bone, there is damage to the olfactory bulb, whatever any damage in this pathway, there is damage to olfactory association cortex. Okay, there is damage to primary olfactory cortex, the information of the smell cannot receive by your brain. Okay, the respected area of your brain. So what type of the condition, what are the clinical name related to it, this is very very important guys. Clinical, clinical, what are the clinical name? The patient who are not able to smell anything. Okay, any good smell, any bad smell, no smell anything, all the function of the smell of the patient is lost. So what are the name of condition is anosmia. Anosmia is a condition in which the patient cannot smell any type of smell. Okay, is it bad, is it good, cannot sense any type of smell. So anosmia. So what are the clinical condition related to it is, guys, you know the COVID-19. In COVID-19 most of the patient also does not smell properly. Okay, so there is a COVID-19 may be damage to this pathway, and due to damage to this pathway and these areas of the brain, the patient cannot smell properly. Okay, so this is the clinical importance. When there is damage to this pathway and you cannot smell properly, there is anosmia condition. Okay, and in COVID-19 most of the patient are affected to this type of symptom. So guys, I hope you understand my video. Please like, share and subscribe it, and press the bell icon for receiving any new video. So guys, please write and made the notes. Okay, the proper pathway related to it, how the information goes to the olfactory bulb, olfactory cortex, how the information goes towards the olfactory tract, and medial olfactory striae and lateral olfactory striae. Okay, related structures. Okay, so guys, be happy, take care.